Studies show that, in fact, we are a little bit more responsible through lifestyle choices for our blood pressure than we are for cholesterol.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending health topics. This Heart Month, we're taking a closer look at the numbers that quietly impact your heart, even if you feel perfectly healthy. From high blood pressure to cholesterol, we're exploring what's genetic, what's lifestyle driven, and what you can do about it. We're joined by Dr. Tarak Rambhatla, cardiologist at Baptist Health Miami Cardiac and Vascular Institute. Thank you so much for being here. So a lot of people just feel like, well, is it really that important? And does it really affect your heart when you talk about high cholesterol, high blood pressure? So can we start off with just saying just how dangerous this can be?
Sure. Well, first off, thank you for having me.
Yeah.
And absolutely. So those are two of the most important and dangerous underlying factors that lead to heart disease or atherosclerosis, cholesterol plaque development in the arteries of the heart.
Yeah.
So we can look at it like this. Atherosclerosis, plaque development, usually follows two reasons. One is the blood vessels become stickier for some reason.
Okay.
And then cholesterol that's floating through our blood is now allowed to stick.
Okay, so just so I can kind of understand it as a non-doctor, your cholesterol is like fat, right? Is that a good way to like waxy fat around?
So actually, yes and no. So when you think about fat like that, we're talking about adipose tissue that's within our external or visceral around our organs.
Okay.
But this cholesterol we're speaking about is actual little cholesterol molecules that are within a transfer protein that circulate throughout our blood.
Okay.
And it's generally that protein takes cholesterol to the tissues, brain, organs, everywhere. And then another one comes and brings it back to the liver for processing. So that cholesterol that's floating through the blood is actually not supposed to stick to the blood vessels. It's supposed to go to the organs that need the cholesterol.
Okay, so then I'm thinking, well, then I guess you want some pressure, right? To kind of get everything going, right? If you think about it. High blood pressure, you're saying not the best.
No. So you need some pressure to have blood circulate throughout our system and get to where it needs to go.
Right.
Too low blood pressure, you don't get enough perfusion or blood flow to those organs, your brain, et cetera. But too high of pressure, we generally say above 120/80 is considered abnormal and starting to become elevated. And it's been shown that pressures above that are too high for the majority of blood vessels. And what it does is it actually leads to little, let's say, cracks in the lining of the blood vessel wall.
Okay.
And those cracks are perfect little areas where the cholesterol can now sneak in. And then it sneaks through those cracks, forms an inflammatory reaction that then leads to plaque, because now that reaction becomes sticky, and then more plaque that just should be skipping through the blood vessels to the organs sticks to that area, and it keeps growing and growing and growing until it either forms a blockage that leads to angina, or even before that, it becomes unstable, ruptures, and forms a heart attack.
Right. And that's why we hear a lot of times plaque around your heart, never a good thing, correct?
Absolutely. Yeah. It's never a good thing. Now, it is just a matter of time. We will all have it. It's next to impossible to die of natural causes in our 80s or 90s without having cholesterol plaque. The goal is, though, is to have that plaque develop slow enough that it doesn't become clinically relevant in terms of symptoms, and you're able to pass away nicely due to natural causes.
We will talk about what slow enough really means, but I'm going to shout myself out right now because I just had my physical and my cholesterol is high. I'm young-ish. Okay, I added the ish there. Youngish. I work out every week. I'm in health. What am I doing? And I mean, if someone's watching and they're going, I'm young as well, I mean, I don't have to worry about this. Why is this mindset actually not great for us to have?
Yeah, so that's a good question. And that's a common misconception and something that we always have to try to kindly educate our patients or the general population on. So you are only responsible for maybe 40% of your cholesterol elevation.
Okay.
Around 50, even upwards of 60 is actually genetic. It's out of your control. Everybody is on a spectrum on how well they either process cholesterol and get rid of it or how much cholesterol they make. Okay, so more than 50% of that is not up to us. That's our genetics.
Right.
It's really that 40%
That
or
I'm
less
working with.
that you're working with, that you're either responsible for potentially causing it to be slightly higher than it would be or being lower. But you're only responsible for 40%. So you could do everything you can. You could eat literally no fat, have a perfect Mediterranean diet, exercise tremendously, have no risk factors, really maintain all perfect health, and you could still have high cholesterol.
Okay.
And it's not your fault.
So when should someone that is young, if they have high cholesterol, when should they worry about it?
Okay. So it's a good question. Now, we don't want people sitting there perseverating, worrying about it when they're teenagers.
Yeah.
But it's never too early to start and adopt healthy lifestyle. Okay. And the problem with atherosclerosis and cholesterol development, it's just a matter of time. So there's actually studies in kids, in teenagers who already are developing fatty streaks in their major organs. So we all develop, cholesterol is going to stick to our blood vessels, and we are going to develop cholesterol plaque at some point in our life. We just want it to happen slower and less each year so that we can, it doesn't escalate to a point where it becomes clinically relevant. Okay. But your question about cholesterol and timing, it's an important one, because the sooner you get to it and lower it naturally, the better. And once we get to an age where we start increasing our risk, or we have other risk factors, we very often might need medications to help us bring it down to a safe level.
Okay, so I just want to get back to the lifestyle, because obviously I'm only responsible for 40%, let's just say, of it. Sure. And the other, is lifestyle choices that I've made: working out, sleeping, eating. What else am I missing?
So what else are you missing for cholesterol and cholesterol health metabolism? So eating healthy. We always recommend either the DASH diet, Mediterranean diet. I always ask my patients to Google it, because there are a bunch of steps on how to follow it. But in general, eating healthy. Lean fish, lean chicken. The fatty fishes are good. They're rich in omega-3 fatty acids. We like vegetables, legumes, lentils, fresh vegetables. Just eating healthy, trying to limit processed foods, fried fatty foods, red meats. Yeah. So that's
all the things we know that we just love so much. It's pretty much what you're saying.
Exactly. And you know what? You're allowed to have a cheat meal once a week or a couple times a week. Please. It's impossible to never eat those good foods that we like, but it's just a lifestyle choice that we have to try to live by as much as we can.
Is it the same when it comes to your blood pressure? Because I know sometimes people are like, their blood pressure, they can't control it. Is it the same as your cholesterol when it comes to genetics or lifestyle?
Yes, but a little bit less. So blood pressure, studies show that, in fact, we are a little bit more responsible through lifestyle choices for our blood pressure than we are for cholesterol.
Okay, so by the way, I'm just going to make a little light of this right now, because you hear people say, like, when they're watching a good game, and everyone's blood pressure was probably through the roof.
That's
Not same type of blood pressure. Let's clear that up.
Okay, so now we're getting into something else, which is your sympathetic fight or flight response.
Okay.
Transient elevations and spikes in blood pressure can be normal, because, like you mentioned earlier, we need to push blood to our organs and improve our blood flow. And that's an adaptive mechanism that we've had since the Stone Ages, so that we could run away from a tiger chasing us. Okay. But that's temporary. The problem is when you have chronic elevations in this blood pressure, where it's there for chronically, majority of the day, majority of the week, majority of the month. That's when it's that high to that level, it starts to lead to damage to organs, damage to blood vessels, leads to plaque formation, or change the architecture of the blood vessels themselves, so they become more stiff, and it makes it harder to control your blood pressure in the future.
Okay, 99% of us are not walking around checking our blood pressure. So what are some of the signs that we should look out for if your blood pressure happens to go up and, by the way, goes down, which we will talk about as well?
Okay, so when you do have spikes in blood pressure, you can start to feel headaches. People can feel discomfort in their chest. They can feel short of breath. But the thing that's really important to know is high blood pressure is often the silent disease that leads to problems downstream after many, many years. So it's very likely you will not know if your blood pressure is high. And usually it's a slow, gradual elevation that your body adapts to. So you don't even realize it. Your body is used to it, but it's causing harm and damage to organs inside. So that's why you won't know if your blood pressure is high. That's why they call it, a potentially silent killer, because you won't know until it's too late.
And high blood pressure, eventually leads to having a stroke. Am I correct or incorrect?
No, you're absolutely correct. High blood pressure, like we talked about with how it helps plaque sneak into blood vessels and lead to plaque formation. That same thing that happens in the arteries of your heart happen in the arteries that lead to the brain and can cause stroke as well.
Right.
So heart attack or stroke, same mechanism.
Okay, let's talk about low blood pressure before we move on to cholesterol, because I am curious. A lot of times, low blood pressure, I would think you're fine. You're chill. Nothing's really bothering you. All good, but not really quite as I'm saying it.
Right. So there's two things. One is your blood pressure just naturally low, and that's when your body's in homeostasis, you're hydrated, you're healthy, you're feeling good, and your blood pressure just runs low. That can be a good thing. That's a good thing. Okay. Because then you have less shear stress on your blood vessels. So they have less negative maladaptive responses to blood pressure, less little cracks to form for cholesterol to stick.
To sneak in.
So low blood pressure is a fine thing, and it can be a good thing. It could mean that you have a good balance of you have less of your stress in your adrenaline nervous system going, and you have more of the relaxing, and that's a good thing. But low blood pressure artificially or iatrogenically, we say, if over medication or if you're dehydrated and volume depleted, that can be a bad thing and lead to not enough blood flow to your organs. I'm
curious because I did see this question come up on the internet, and that's exactly what we do, right? We debunk some of the questions that we see and we talk about it. A lot of people have said, if you don't eat, if you're a little hungry, if you're fatigued, if it's been one of those days where you're just running around and forget to eat, and you don't eat, that all of a sudden you could have low blood pressure. Does that have anything to do with it?
It can. Yes. If you haven't eaten or drank all day or for a long period of time, you can get dehydrated. Your salt and water balance is down, and your blood pressure could follow and also go down. And that's not a good thing. You want to stay hydrated. You don't want to have electrolyte imbalances, and you always want to make sure you're adequately hydrated. Absolutely.
Yeah. And that's what we always say, drink water, make sure you're hydrated so you can feel best.
Drink water, but also water might not be enough. You might need electrolyte containing solutions, because generally for us to absorb water, we need some electrolytes and salt.
The human body, it's just so tricky sometimes.
It's incredible.
It's fantastic. It is a phenomenon. Let's talk about cholesterol, because we've also heard of good cholesterol, bad cholesterol. I just feel like all of it would be bad. Break it down for me, please.
So generally when you see, and it's a really good question, when you see that total cholesterol on your lipid panel, so it's including your bad cholesterol, which is your LDL, think L for lousy. It's including HDL, H for happy.
Okay.
So that's the good cholesterol you're thinking about.
Yeah.
And then it's including your triglycerides. Okay. So the bad cholesterol is what we were talking about. The one that generally the smaller, the worse it is, and it can sneak into the little cracks. And that's your LDL. That's your low density lipoprotein. Okay. Then you have the HDL, which is the good cholesterol, happy cholesterol. And that's the one that actually goes and grabs cholesterol from outside the liver and brings it back for processing. So it has a good mechanism in terms of reducing your total body bad cholesterol, but it does not negate having high bad cholesterol. So high good cholesterol doesn't mean you're protected from high bad cholesterol.
Okay.
It's just part of the body's mechanism of returning cholesterol back to the liver.
Do they both kind of work in correlation with each other?
They do in a sense, but like I said, again, having high good cholesterol isn't going to combat the bad cholesterol.
Got it.
Okay. Now, if you naturally have high good cholesterol, that shows that your body is healthy and you're doing the right thing, but it does not negate another risk factor.
Another one. Yeah. Okay. I'm glad you cleared that one up for us.
So what I would actually say is don't focus so much on, I don't want people or patients to make themselves feel better by having a high good cholesterol. We should, honestly, if you want to focus on one thing, focus on your bad cholesterol.
Okay.
And make sure that it's within the goal that you've established with your doctor.
Okay. What's one thing that you wish people understood when it comes to high cholesterol and high blood pressure?
Yeah. So the thing I always try to, the knowledge I try to impart to my patients is they are all on a spectrum. So just because you have high bad cholesterol, technically doesn't mean you're going to have a heart attack. And even if you have low, good levels of bad cholesterol, doesn't mean you're risk-free. They all work together. So if you have really sticky blood vessels, we call it endothelial cell dysfunction, endothelial meaning the lining of the blood vessel. If those are sticky for some reason, because of high blood pressure forming those little cracks, diabetes making it more sticky, smoking, other risk factors, obesity, genetics, which just genetically, if heart disease runs in your family, you could have low cholesterol and it will still stick and form plaque.
Oh.
Similarly, on the converse, if you have no family history, you don't smoke, you exercise, you maintain good health, good sugar control, eat healthy, and your blood vessels are just not sticky at all, you could have really high cholesterol and it'll just pass through the blood vessels and not stick.
Hey.
So every lab marker is different for each individual person.
It's funny that you say that because my next question is men and women have are completely different. Our makeup, right? It is what it is. Good luck trying to explain that one. But when you see a woman and a man, high cholesterol, high blood pressure, it's different for men and women. So how do you break that down?
It is to a level.
Okay.
So the main thing in terms of why women generally have heart disease later in life versus men is women are generally protected by estrogen. So during prior to menopause, the estrogen generally protects them. But when they're postmenopausal, they catch up to us and can even accelerate faster.
I was just going to say, do we catch up quickly?
You can, yes. Because once that estrogen protection goes away, all those other risk factors that might have incurred during formidable years will start to work and can work rapidly. So it's very important for women, although they can be more protected during those initial years, to still be very aware of their risk factors because they certainly will catch up to men, especially in the postmenopausal period, and they are equally at risk. And sadly, heart disease is still the number one killer of women.
For women, yeah. And if you have family history on top of that, does that just make it even messier?
Absolutely, for both sexes, for men and women. Family history is a very strong risk factor for you. Now, family history, but if your father or your mother smoked, drank, had diabetes,
didn't have a great lifestyle,
that's not the family history we're necessarily talking about.
Okay.
But if they were generally healthy and just every male or every woman or multiple people on 2 or 3 generation family trees all had heart disease, you're at high risk. And probably because of what we were talking about. For some reason, either their blood vessels, due to genetic reasons, are a little more sticky, or their cholesterol profile, they have the more atherogenic cholesterol. We can talk about that later, but not all bad cholesterol is equal. There's worse bad cholesterol than others.
Oh, it's just so confusing sometimes when you sit there and you're like, okay, so is it good or is it bad?
It's bad. Just think about it.
It's all bad.
Yeah,
it's all bad.
Yeah.
Okay, a lot of people constantly Google what is a normal blood pressure. And I will tell you, I've gone to the doctor, got my blood pressure, and I'm like, they're like, whatever it is. And I'm like, what does that mean? What is the number I'm looking for?
I know. It's tricky. And the target has moved a little bit in the last 10 years. Well, because it's hard to, not one number fits all. And as we start to age, above 75, above 80, there is some negative consequences of trying to achieve extremely low blood pressure that we would like for you and I, because they are at more at risk for low blood pressure consequences, and we call hypoperfusion. But outside of that patient population, in general, 120 over 80 and below is considered good. Okay. Once you start getting above that, studies show that you have just a stepwise increased risk of heart disease and stroke and kidney disease and end organ damage, we say, because now that pressure is still too high for all the organs to tolerate.
Got it. When it comes to keeping your blood pressure in check, is there something as we get ready to go to the market and meal prep, some foods? I know you mentioned a lot the Mediterranean diet, but is there something that we should just reach out for in the grocery store and say, I'm adding this to my cart because this is what I need for my blood pressure?
Yes. So the first thing you can do is, I actually ask all my patients to do is, first, before putting something in, put something out and put the alcohol back.
Oh, come on.
Yeah. So no amount of alcohol is good for you.
Not even one glass of wine, as researchers have said that it might be good. And then they've come back and
Surgeon General
withdrawn
included, because no amount of alcohol is good. And the old theory and staying of the antioxidants with red wine, you can get antioxidants anywhere else, but there's no amount of alcohol that's good. It actually changes your cellular structures too gradually.
I know sometimes it makes me feel a little happy.
True.
Okay.
But aside from that, all jokes aside, so high potassium containing foods, spinach, kale, green leafy vegetables, low salt diet. So definitely staying away from processed foods, chips, all these things with added salt is a good way to maintain your at least dietary recommendations for blood pressure.
Okay. Yeah, I know. So no alcohol.
No alcohol, minimal salt, high potassium containing foods.
Okay. Now that we're just in the topic, should there be a number of times that we work out? And when I say work out, go for a walk a number of times a week. There was just a study today that came out that said just working out one day a week will actually help you when it comes to aging.
Yeah.
Is that true?
So any bit of workout that you're able to do is a great amount. But in general, even a little bit is better than nothing. So once a week, once a day, all of that is great. But the American Heart Association recommends roughly 20 to 30 minutes of aerobic moderate intensity, 5 days a week. Okay. So that's what we like. Zone 2 cardio, getting the heart rate up where you're sweating a little bit. You don't have to sweat too much. It doesn't have to be extreme activity, but moderate intensity for a good duration, 20, 30 minutes.
And I might be saying this incorrectly, so please correct me if I'm wrong. The Blue Zone diets and lifestyle that people have spoken about, how much of that do you back up for us to research and look into?
Yeah, so it all has to do with healthy lifestyle, diet, exercise, and more studies, especially longevity studies, are showing how exercise and muscle strength combined are the keys to healthy life and longevity. Maintaining muscle mass is very important, but cardiovascular exercise, extremely important, for multiple reasons. One is trying to maintain a good body mass index, because unfortunately obesity has
spiked up.
Yeah, it's a problem.
Especially with young children. I have seen young teens. It's an issue.
It is more and more of the computer, iPhone generation, less exercise, easier access to bad food and obesity. And once it starts, it's really hard to stop. And it's pro-inflammatory. It increases blood pressure, increases heart disease, risk for sleep apnea. And it's just a vicious cycle of a cascade of different conditions downstream. So exercise, maintaining good body mass index, extremely important for longevity.
Okay, so to wrap things up, because we're not going to leave everyone hanging, screenings, when should we start? And what's the easiest way for us to just kind of like get in there?
Okay, know your numbers.
Okay, we'll start there.
Know your numbers. Please, everyone listening, everyone watching, know your numbers. Know what your lipid panel is, including your LDL. Know what your hemoglobin A1C is, which is a marker of your sugar control over 3 months, okay? Know what your blood pressure is, and know what your body mass index. 4 things. Lipid panel, hemoglobin A1C, blood pressure, body mass index. Those 4 things, if you know those and they are well controlled, you are on your way. Okay. But that's a bare minimum that I would really request everyone to know.
Any specific age you want us to go and start getting checked?
Whatever age you are now and listening to this, go get checked.
I absolutely love that. And no alcohol. I will take that. Thank you so much.
My pleasure.
This really has been a great conversation. I feel like I learned so much. So thanks for sharing all your insight with our audience. And remember, to our viewers, be sure to hit that subscribe button that you see there. Thank you so much for watching. We will see you next time. Be safe.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.